Hello everyone, my name is Hiranyada and today I'll be covering the question of bone marrow suppression and aplastic anemia. So first of all, what is the definition of this? So when there is an attenuation of hematopoiesis in bone marrow, which is due to the destruction of the stem cells, then we call it bone marrow suppression. And mostly the origin of this attenuation is autoimmune. So we can classify it into two types, the primary one or the secondary one. The primary one is usually idiopathic. The secondary one is happens because of some other primary cause. So, for example, as I mentioned before, it can be autoimmune. It can be due to infections such as the Epstein Barr virus or the parvovirus B19. It can be due to drugs or toxins such as methotrexate, benzene, or post radiation. So, for one point that is important to note here that there is a problem with this nomenclature. They say that it's aplastic anemia, but the name itself is incorrect because there is no aplasia and it is not congenital. It is a disorder that develops over lifetime and is acquired. So, focusing on the microscopy, what we find on the histology is the are the adipose tissue, lymphocytes, plasma cells, and mast cells. And then also that the hematopoiesis is completely absent. The complications related to bone marrow suppression and aplastic anemia, the primary one is anemic syndrome, and if it is severe, then we can also see thrombocytopenia and neutropenia. So there is no production. That means you will see anemia because of reduced RBCs, thrombocytopenia due to decreased platelets, and neutropenia due to decreased leukocytes. And a consequence for this will be increase in bacterial and fungal infections because of the neutropenia. There can be increased bleeding because the primary platelet plug won't be formed because there's thrombocytopenia, and the patient will present with symptoms of anemia. Therapy for this includes immunosuppressants because, as I mentioned before, that it is usually autoimmune. Also, the therapy also includes treatment of infections if the etiology is infectious, and administration of blood derivatives to manage the symptoms mentioned above. In case it is very severe and irreversible, a bone marrow transplant is indicated. So, a quick look on the anemia due to underproduction. So, again, what is the basic principle? The basic principle is that there is decreased production of RBCs in the bone marrow because there is destruction of the hematopoietic stem cells. This is also characterized by a low corrected reticulocyte count. The etiologies can include the macrocytic and the microcytic anemia, which are due to multiple other causes. It can be due to renal failure because in renal failure there will be decreased production of the erythropoietin, and this can lead to a decreased production of the red blood cells. It can also be due to damage to the bone marrow precursor cells that further leads to anemia or pancytopenia, and the symptoms of were mentioned above. As for infectious etiologies, we have parvovirus B19. Now, the parvovirus B19 basically infects the progenitor red blood cells and temporarily, again, remember the word temporarily, halts erythropoiesis. This results in a significant anemia and also excessive bone marrow stress. The treatment for this is supportive. Because parvovirus infection is self limiting, we wait for the infection to resolve itself. The next part of the question says aplastic anemia. The basic definition for aplastic anemia is that there is damage to the hematopoietic stem cells, which leads to pancytopenia. Now, whenever I say pancytopenia, we need to remember that there will be anemia due to decreased RBCs, thrombocytopenia due to decreased platelets, and leukopenia due to decreased leukocytes, and of course, with the low reticulocyte count. Etiologies or causes include exposure to drugs and chemicals, viral infections, and some kind of autoimmune damage. I will discuss the treatment at the end of this lecture. So, focusing a little more and in detail on aplastic anemia. Now, anemia is a multipotent myeloid stem cell disease where they are suppressed. What happens is it results due to a bone marrow failure and can lead to pancytopenia. And the three symptoms of pancytopenia were discussed previously. Now, aplastic anemia can be classified into two types, the extrinsic one and the intrinsic one. So, focusing first on the extrinsic one, over here we see that it is an immune mediated bone marrow suppression. So, because of something external and not essentially due to a problem with the bone marrow. So, immune mediated. So, what happens is that the activated T cells suppress the hematopoietic stem cells. So, stem cells are antigens and they are altered by drugs, infections, or any kind of environmental insult. So over here is a short mechanism of it. So we have the Th1 helper cells that are activated and they produce cytokines such as the interferon and the tumor necrosis factor. These cytokines suppress and kill the hematopoietic progenitor cells. So this is about the intrinsic. The intrinsic one is due to an innate stem cell abnormality. It can be due to some inherited defect of the telomerase. So that means that there is premature aging of the hematopoietic stem cells, or it can be due to short telomerases. Now, telomerase is again, as I mentioned before, associated with aging. So there will be a defect in, so there will be a defect, and the aging will be faster, and because of that, the hematopoietic progenitor stem cells are damaged. Now, moving on to the clinical features. So, the epidemiology is not very clear. It can happen to people of both sexes and all ages. If you look here on this page, you can see a set of symptoms. So this is a set of symptoms that a patient will present with if he or she has aplastic anemia. So as I mentioned before that there is pancytopenia. So with anemia, you will see symptoms of anemia. There's weakness, there's pallor, there's dyspnea. With thrombocytopenia, because there is a problem in the formation of the primary plug, because the platelets are less, you will see petechiae and ecchymosis. And with neutropenia, you will see that the patient is susceptible to a lot of minor and opportunistic infections. And on the peripheral blood smear, you would see reticulocytopenia. The prognosis for this disease depends from patient to patient and is very unpredictable. Hematopoietic stem cell transplantation is an important treatment option and is usually done in patients who are less than 40 years of age and have not been transfused. Following this particular transplant, their body is conditioned with immunosuppressive treatment such as immunosuppressive radiation and chemo. So before I end, I would like to mention something called as the myelophthisic anemia or the myelophthisic syndrome. Now, myelophthisic syndrome is extensive infiltration of the marrow by tumor or other lesions. This is usually seen in cases of a metastatic prostate cancer, metastatic breast cancer, and metastatic lung cancer. It is also seen with certain lipid storage disorders in case of advanced tuberculosis and osteosclerosis. The patient here also again presents with pancytopenia because there is destruction of the hematopoietic progenitor cells. So the patient would present with anemia, thrombocytopenia. There is a very classical shape of RBCs associated with it. So you'll see that the patient has teardrop shaped RBCs, and there is leukoerythroblastosis along with immature granulocytic lesions. So, we've already mentioned about aplastic anemia and how it causes pancytopenia. Again, as a short recap, we have certain causes. So, we have the inherited causes, which are due to telomerase defects, or the Fanconi anemia, which is a problem in the DNA repair mechanism, or it can be acquired, which is usually termed as your extrinsic aplastic anemia, which can be due to chemical agents such as drugs, or can be due to whole body irradiation, or in case of viral infection such as CMV, herpes zoster, or hepatitis. Diagnosis for this is done using a bone marrow biopsy, and you can see that in aplastic anemia, the bone marrow will be hypocellular. And as for the patient, you will see some ulcerous gingivitis. You can see petechia on the skin. You can see purpura, which is more common in the brain. And you will see ecchymosis in the intestine due to thrombocytopenia. Lastly, there is pure red cell aplasia. Pure red cell aplasia is a primary bone marrow disorder where only the erythroid progenitors are suppressed. So, no thrombocytopenia, no neutropenia, just anemia because the erythroid progenitor cells are suppressed. The etiology for this is autoimmune disorders, or as I mentioned before, it can be due to the parvovirus infection that destroys the RBC progenitors. The parvovirus infection usually is self limiting and clears within 1 to 2 weeks. This also can occur in association with certain neoplasms, particularly a thymoma, which is a tumor of the thymus, or a large granular lymphoma. So resection is needed in order to improve the life of the patient in such a case. Patients who are without Patients without a thymoma can undergo immunosuppressive therapy, which is beneficial for their treatment. So, this was all about this particular question. Thank you guys for your attention and hope to see you guys in the next one.